today I'm going to talk to you about how to best communicate with your healthcare team, how to empower yourself to be an advocate for you and your family. Ask those questions, and I want to thank Shirley and Robert for really, you're giving me the real life examples of how to best communicate with your team, asking the important questions. Play an active role in your care, because you can change the course of your care by actively participating in your care. Next slide. So, unfortunately, there are barriers to healthcare. So, financial barriers, lack of insurance, we all know the high cost of healthcare, but cultural barriers. So, and this can include language barriers, different belief systems, but even stereotypes, and different beliefs and cultures between patient and provider can lead to misunderstandings and miscommunication. So it's really important to understand culture and to understand how someone might be perceiving their healthcare needs, their views, their perceptions on medicine and health. And as a provider, that helps me understand what my patient's needs are and maybe even enhance my communication. And of course, systemic challenges. This is access to care, and this is access to high quality care. And I think Dr. Cole gave a good example with his grandmother, high quality care. And it can be geographical constraints, and it can circle back to financial constraints, but it's really that access to good quality care. Next slide. So how do we start? And unfortunately, this mistrust between patient and provider exists because historically we do have disparities in healthcare, which has affected patients' access to healthcare and outcomes. And so this lack of sensitivity amongst healthcare team members can negatively impact trust with patients. But really, trust is the foundation of a good partnership between your provider and yourself. So we start by going and having your annual checkups, going for your annual visits, having a primary care physician, seeing that physician every year. Next slide. So regular checkups are important. So I'm not going to focus on myeloma at all. What are these annual visits to your physician for? So hypertension, high blood pressure. Half of Americans over 20 have high blood pressure. Don't even want to check my blood pressure now because it's probably through the roof, but this is such a neglected condition, and it can actually lead to more serious complications, heart disease, stroke, kidney disease. And we know that the kidneys are, we need our kidneys to be helpful going through our myeloma treatment. So we really need to have routine blood pressure checks and control it and modify, getting advice on how to modify our diet and increase our exercise. Diabetes or high sugar. 37 million patients in the US have diabetes or high blood sugar. So we need to routinely check our blood sugar. So out of the 37 million patients with high blood pressure, 1 out of 5, they don't even know that they have diabetes. So getting your blood sugar checked, yearly trending the values to see and looking at your risk factors. And again, diet and exercise can help this. And then screenings for cancers. So we're so fixated on our myeloma, but there are other common cancers that we need to screen for. Breast cancer, colon cancer, prostate cancer. We can screen for these types of cancers, and early prevention is key. Next slide. So disease monitoring. So patients who do have chronic conditions, having that regular checkup with your healthcare provider, we can manage chronic conditions like your diabetes and hypertension, manage heart disease. We can prescribe medications to help control these conditions. And if we see that you're not tolerating or it's not quite managing your blood pressure, we can make changes to your treatment plan. And then we can give you guidance on lifestyle changes, how to modify your diet, again, so that you can be the healthiest. Next slide. So even if you're not sick or you don't have a chronic condition, going to your primary care once a year is important because preventative care, you want to stop something before you have something. So vaccines and immunizations, and unfortunately vaccines have gotten a bad rap lately, but they prevent disease, they prevent serious complications. So it's important that going for your annual flu, COVID boosters, RSV vaccinations now, so we try to prevent disease in that primary care setting. So making sure you're up to date with your vaccinations, your primary care will guide you towards that. And I talked about cancer screening, so mammograms, colonoscopies, getting blood tests for prostate cancer, looking at the PSA. We can all monitor this and do your health routine screenings. And we provide you with guidance and health education. What should your diet include? How much activity you should be getting? And then if you're smoking, please don't. But you have to communicate, right? So when you're visiting your team, you need to have that open and honest conversation with your team. I can't provide you the guidance if you're not telling me what's going on. So don't hesitate. We've been in this profession so long, nothing will shock me. So please be an open book to your team. Next slide. And then be part of that decision. And this is like what I think Shirley and Robert really talked about. Are you being told? Are you part of the dialogue? So that shared decision making is a partnership where your provider, your team, and yourself are coming together to make the best decision for you. So it's a two-way street. It's not a one-way street, two-way street. You're getting information, you're giving information, you're receiving information. You're both coming to an agreement on what best is the best treatment plan for you. And remember, if you make a decision, nothing is written in stone. You can always revisit and change your mind. This treatment is not for me. Can we reevaluate? Can we look at some changes? Coming in twice a week for an infusion is not, I can't care for my family. So you should have that dialogue. And it can sound like, I'm concerned about the impact of my health and my ability to care for my family, or, what are the pros and cons of this treatment you're recommending? What are the side effects? And, you're in the exam room, you're given a treatment plan. You don't have to make a decision that day. So unless time is of the essence, which it's usually not, you can go home, talk to your team, your family, your loved ones to make the best decision for you. Next slide. So tips on communicating. So before you even show up at your doctor's office, think about what's important to you, write down your questions, and prioritize them. We know sometimes our face-to-face time with our team might be limited. And I might not be able to get to all your questions, but I want to get to the questions that are important to you. So write down those questions, prioritize them, and if you can, bring someone with you. A second set of ears, because sometimes we're so overwhelmed we're not hearing everything. So a second set of ears, and one extra mouth, because someone asking questions might be thinking of something that you're not thinking of because you're so overwhelmed. So someone coming with you, or even if you have to phone them in, that's okay. And I don't mind, you can ask, you're giving me a lot of information, maybe I can record you, so that someone else can listen to this with you, because it's a dialogue. During your visit, take notes, or like I said, record, and have someone listen. And then you're given options, ask for time to think about those options. Nothing needs to be done here and now. You should take time to think about it. And then after your visit, continue to learn. And I think that's why Yalik is a 26-year survivor. He learned, he got out there, he asked the questions, he advocated for himself, and he's a 26-year survivor. So research, come to events like this, learn as much as you can. Next slide. So what to communicate? Your family history. Does cancer run in your family? Know what your risk factors are. So we know that race, gender, age, and obesity, so weight, can all affect different types of conditions and cancer. ask questions about your test results. So what does it mean? You're given a piece of paper, what does this mean? And I think, Shirley, you spoke to it too. They were monitoring my blood work, but no one told me that it was progressively getting worse. What do I need to look at? What does it mean? Why are you doing this test? Ask. And know what your priorities are. What are your preferences? What are your goals? Let us know. If I don't want to come into clinic, I have to care for my mother, I have to care for my children. Let us know. We'll come up with a plan that is right for you. Ask what the side effects are, right? Here's a new plan for you. What are the side effects? I think, doctor prescribed me treatment plan A, and then we just walk away. But there's always side effects to every medication we give, even aspirin. So be informed, know what the side effects are, what are serious side effects, when I need to call. And then some symptoms that you should never ignore. When do I need to call the office? When I have a fever, when I'm in severe pain. My goal is to keep you out of the emergency room. So you're never bothering your doctor or your team by calling them. We get hundreds of phone calls a day, and we answer them. So please don't keep it to yourself. I don't want you to end up in the emergency room. Next slide. And remember, symptoms are not just physical. And I think we focus too much on the physical. There's also emotional and financial. Emotional, feelings of sadness, anxiety, sleep disturbances, and then financial, toxicity of the financial burden of co-pays, deductibles. It can add up, and that can add into the emotional distress that a lot of patients feel. Next slide. So a little bit more about depression and anxiety. A third of patients report being depressed and anxious, and I actually think that this is underreported. Patients don't like to share their emotional side effects. If you don't share with us, I can't help you, and no one really should be going around feeling such distress, because that can actually affect your physical symptoms. So share with us. We have resources for you. We can help you through. These are difficult times, stressful times. Let us help you. Next slide. And then financial burden. So myeloma is one of the most expensive diseases to treat. We know that there are premiums, co-pays, but travel expenses. I'm in New York City. Everything costs money just to ride over the bridge and park your car. Someone could be paying over $50 a day just to come and see me. So we're aware of that. Prescriptions are very expensive. Myeloma has one of the most expensive drugs for patients. And then loss of income. Time away from work to come into clinic, get your treatment, see your doctor. That's all time away from work, lost income. Talk to us about us. There are so many programs available for patients to help with drug costs, provide medications. Most teams are working with social workers, and there's an abundance of resources available to patients. You just need to know to ask. My social worker is literally my best friend. She helps my patients. Anything from travel, hotel stay, to free medication. There are resources available to you. Next slide. So you want to be prepared for your appointments. We talked about this. Write your questions down, prioritize them, and then bring a list of all your medications, and it needs to include vitamins and supplements because some supplements interact with some of the treatments we give you. We need to know all this information. And then you need to tell us if there's any medical or life changes since your last visit. And then let us know what your symptoms are. I'm having more back pain. I'm having an increase in fatigue. Let us know. This is how we help manage you. And then your appointments. Understand your treatment plan. Why am I on this? Again, what are the side effects? What are the next steps? What is the goal of this therapy? And then back home, again, take precautions, be healthy, communicate with us. We can direct you on diet and exercise and activity. Take your medications as directed. If there's issue obtaining your medications, cost, etc., let us know. There's alternatives and there's resources available to you. And then don't be afraid to call. You are not bothering us. We are a team, and if there's something going on, give us a call. We'll help manage through. Next slide. And then there's a new option, COVID. A lot of the bad, but some of the good. Telehealth became very abundant during the COVID pandemic, and so if this is an option for you, you can consider a telehealth visit. You want to check with your provider to see if they offer this service, but this is something you can do anywhere. You just need a smart device, like an iPad, a phone that has a camera. You're going to need Wi-Fi in a quiet place. Do not do this while you're driving. Pull to the side of the road, you'd be surprised. And then just make sure if you're doing a telehealth visit that you know what the next steps are. When am I due back in clinic? When is my last blood work, etc. Next slide. And so, healthy lifestyle, keep adapting. The healthier you are going into a new therapy, the healthier you're gonna be coming out of it, and better tolerating it. So managing stress, and these ladies here are doing yoga. Yoga is not my thing, but stress, go out, take a walk. And now we're getting into the winter months, so the coldness makes me forget why I was stressed and angry, and I come running back in. So, things that can help you alleviate stress, promote sleep and rest, maintain a healthy weight, be active, and I'd say it again, if you're smoking, stop. And then, making sure you're engaging in your social activities, you don't want to be isolated, and then just going in for your routine checkups. I know when patients have myeloma, everything else falls to the side. But remember, you're still at risk. You want to continue your screenings, mammograms, colonoscopies, etc. Don't let those fall to the wayside because you're so focused on your myeloma. So continue to see your primary care team. Next slide. And then we talk about weight. And believe me, I love food, so I'm not going to lecture you on what to eat. There's a bucket of candy in the back there, but let's try to minimize sugars, incorporate more plant-based foods, so fruits and vegetables. Healthy fats are good, avocados, nuts. And then alcohol is okay, but make sure you can walk straight afterwards. So everything in moderation. Next slide. And maintain strong bones, because we know that myeloma, we have bone complications, so the benefits of exercise, and again, it could just be going for a walk. And this actually helps with fatigue. Even though you're too tired to do it, if you get up and do it, you actually start feeling better. So go for that walk and try to be as active as you can. Next slide. So this is my last slide, and as you can see here, this is a two-way street. So it's a dialogue with you and your team. It's okay to speak up. It's okay to ask questions. You're not going to offend anybody. Even if you need to go for a second opinion, no one will be offended. Speak up. Advocate for yourself. Ask those questions. And together, you're going to change for the positive for your care and long-term future. So thank you.